Noonan Syndrome. What is Noonan Syndrome? It's a genetic condition that affects both males and females. Typically includes heart abnormalities and characteristic facial features. 1/3 of children affected by Noonan syndrome have mild intellectual disabilities. Physical characteristics: unusual facial features. They're of short stature generally. Heart defects. Small lower jaw. Their face may appear droopy. Large prominent forehead. And often have crooked teeth. Behavioral characteristics: they are generally fussy eaters. They behave immaturely compared to their peer counterparts. They often struggle with attention. They struggle with recognizing their emotions, and often also diagnosed with ADD due to their inability to focus. All right, the history of Noonan syndrome. Jacqueline Noonan in 1962 recognized similar facial characteristics in her patients with cardiac abnormalities, skeletal mutations, undescended testes, mild mental retardation. She reported these findings and was later given its own diagnosis. The first genetic cause of Noonan syndrome was found in 2001. Since then, multiple genes have been found to be the cause of Noonan syndrome. So, short case study. We have a boy named Drew. Drew was diagnosed with Noonan syndrome prenatally at only 19 weeks. He was expected to need extensive care immediately after birth, but instead surprised everyone and did not require any additional care, including the NICU. Drew's parents took him for a checkup at 2 months, where chest x-rays revealed that Noonan syndrome complications had developed. A chest ECG revealed fluid building around the lungs. Drew was then moved to the PICU intensive care unit, where his team thought he would have the best shot at survival. A few weeks later, Drew was later admitted to the hospital with more health issues, to include organ failure. The hospital hooked him up to a machine that gave his organs a much-needed break. This allowed him to recover for about a week until he developed a brain bleed. He finally recovered, and his body developed enough over the next few months in the hospital, and he was finally able to go home once again. He spent 4 solid months being monitored by doctors and examined before he was allowed to leave. Today, Drew is 4 years old and living a great life. He is able to run and play with other kids. He is verbal, and his body, to include his heart, seem to be holding strong. His mental capabilities are slightly hindered, but with the help of early intervention services, they are hopefully he will meet many developmental milestones in the years. So there are many interventions and supports for child with mild to moderate disabilities. For Noonan syndrome, it's really no different. For behavioral supports, there are special education services, occupational therapy, and speech services that are available at early intervention. Depending on the severity of Noonan syndrome itself, there are many different life-threatening conditions that can develop or underdevelop in his body that could cause life-threatening issues, but most of them are mild and will be outgrown to a certain extent. But there are certain physical characteristics that will be with the child forever who has Noonan syndrome. Some of the strengths that a child with Noonan syndrome has is often it is a mild intellectual disability, and they can eventually live on their own and even live a fairly normal life despite some of their physical characteristics. And their weaknesses generally are that they have physical ailments for the rest of their life. Even if their intellectual disabilities are mild, their physical development was forever stunted. All right, thank you.